joint damage right in the cartilage. You could see some bone deformity. And when I started at the Arthritis Foundation more than 20 years ago, I met a lot of volunteers and a lot of people with arthritis that had severe deformities in their hands because we didn't have access to some of these newer medications that can really prevent some significant joint changes because of your immune system being out of whack. Those new medications help tamp down the immune system and prevent this joint damage. So again, it's really important to understand the difference between osteoarthritis, which tends to occur in a single joint, right? A knee, a hip, a shoulder, a thumb, versus rheumatoid arthritis that affects the whole body, right? In addition to joints, it can affect your eyes, it can affect your gums and your mouth, it can affect your cause inflammation of your heart and lungs. It can cause skin issues. It can have a whole host of other conditions associated with this immune system being out of whack. So I just really want to make sure that you know the difference. And the last thing I'll say about rheumatoid arthritis or other forms of inflammatory arthritis is that there are doctors called rheumatologists. And a lot of people outside of the arthritis world have never heard of a rheumatologist, but rheumatologists are arthritis specialists. And do me a favor, if you meet someone that says they have inflammatory arthritis, they have rheumatoid arthritis, ask them who their rheumatologist is. And if they can't give you a name, insist that they go to a rheumatologist because they'll get the best possible care and can prevent some real significant joint damage and pain in the long run. Let's keep moving forward. So oh my gosh, there's these different forms of arthritis and there's all these different types. Like, am I going to get arthritis? Is it inevitable? Well, I'll tell you, there are some risks that are modifiable. That means we can do something about it. And there are some things that we have less control of, right? Unmodifiable risk factors. So on the left side here, the modifiable. So things that we can control, at least to some extent, is our weight, right? Keeping a healthy weight is one of the best things that you can do no matter what type of arthritis that you have because it puts less stress on your joints. Now, for every 1 pound that I'm overweight in my midsection, that puts an extra 4 pounds of pressure on each knee. So just losing 10 pounds can take a lot of pressure off of my knees and my joints. So keeping a healthy weight is really, really important. Infection, and joint injuries, right? You want to be safe. You know, we want to make sure that kids play sports safely. We want to make sure that you're working safely on the job, especially if you have a manufacturing or agriculture jobs that tend to have a high rate of injury. Those agriculture and manufacturing jobs, right, can cause a lot of repeated movements, particularly if you're putting your body into a stressful position. That can be an increased risk of arthritis, and certainly smoking is no good for you and can cause increased risk of arthritis. Things that we can control a little bit less is, you know, how we age, you know, what gender we were born, and our genetics. You know, some people's cartilage just wears away faster than others, right? And in families, there may be a genetic link with rheumatoid arthritis and other forms of inflammatory arthritis, although we're still sort of working that out. Next slide, please. So let's look at how these diseases impact our country. We talked about that there's a lot of people that live with arthritis, and it's not just affects a lot of people, but it causes a lot of disability. It's the top cause of disability in this country. And it's the second largest cost of employer health care costs. So again, insurance, you know, costs are passed on to everyone, right? So that has an impact on everyone. It has an impact on your ability to work, right? 1 in 4 employees on a health plan can live with arthritis. It interferes with your day-to-day activities, your ability to get up, get dressed, brush your teeth, get bathed, go get to the bus stop, take care of your family, volunteer. All of those things, it can have a tremendous impact on, and it has a huge impact on your ability to work, and it can be very expensive, right? Arthritis is expensive. Think that 304 billion, that's every prescription, every cost for joint replacement surgery, for the brace that you need to buy, for the injection, cortisone injection you need, right? All of these costs add up to a significant amount of money. Next slide, please. And arthritis is something that we all recognize has a physical impact, right? We all know that it causes pain, and most people recognize that, but there is a huge connection between your physical health and your mental health, right? And when you are in pain and you're tired because it hurts all day, and when it hurts, then you move less efficiently, and you're with some forms of arthritis, like those inflammatory forms of arthritis, your body is literally battling itself. So that's tiring. And so when you're stressed and you're tired and you're in pain, that often leads to conditions like anxiety and depression. And even though there are so many people that live with arthritis, right? The 58, plus million people that live with arthritis, I meet so many people that feel like they can't talk about it. They feel alone. They feel like they're the only one that really has arthritis, that it really hasn't captured the national imagination in many ways. And so many people feel like, they don't want to complain. They just want to deal with it. And it causes a lot of stress when you're dealing with a condition that is so common, yet so rarely talked about. Next slide, please. And right here in the Tar Heel State, we've got about a quarter of people living with arthritis, a quarter of our adults. And as your age it increases, your risk factor for arthritis increases. It's not automatic, but again, at 65 to 74, about more than half of North Carolinians are living with arthritis. And then when we get up into those when we talk about folks who are unable to work, right, about 2/3 of them have arthritis. That disability is high in North Carolina as well. So next, we're going to introduce Serena to dig in a little bit more about how arthritis can affect older adults.
Yeah, thanks so much, Nick. And Nick just touched on this in a couple slides, but I wanted to kind of drill down on it even further. Older adults are disproportionately impacted by arthritis. So he did just mention on the previous slide about impact on activities of daily living. And I just wanted to show this, this graph here, not because I think you can all read the tiny print, but because I wanted to just highlight the colors here. And the people 65 and older are the yellow line in each of these different topic areas. And as you can see, the yellow line is the highest in each of them, indicating that they are most impacted, from everything to their ability to walk to their ability to work. So I think that that's probably something that really resonates with the people on the call today. Another thing, next slide, that I think is really important to draw the connection between is arthritis and falls. It's oftentimes people who have arthritis have some sort of weakening in the muscles that help with balance and stability, primarily in those lower body joints like the hips and the knees and ankles. And that weakening can then impact the person's gait, how they walk. So it can often cause some shuffling, which if you know anything about falls, you know that shuffling can lead to falls because we often will get tripped up on maybe a crack in the sidewalk or a throw rug or something like that. Also, people with arthritis are sometimes prescribed opioids. A risk factor of opioids is increased risk of falls. So when we're thinking about arthritis plus the aging population plus the increased risk of falls, it really kind of calls our attention to the need to do something about this. And that's what we're going to talk about next. Are some of the resources that are available to those of us on the call who are interested in learning more, because maybe we're individuals with arthritis, or promoting more information and delivering programs that can help people with arthritis. So maybe you're in an organization that is supporting those individuals, and we want to share some resources that can help you as well. Next slide. So the CDC outlines key strategies for individuals. These include learning self-management skills, so how to manage arthritis when you have been diagnosed with it, being physically active. So a lot of times people who have arthritis or who have been diagnosed with arthritis instinctively think that they need to stop moving to protect the joint, to not wear it out further, when in fact, the opposite is true. Physical activity is one of the most important things people with arthritis can do to better manage their symptoms and their disease. So increasing physical activity, or even just becoming physically active, is going to be important. And then, of course, effectively communicating with their healthcare providers, talking to their healthcare providers about the symptoms that they have. As Nick mentioned, a lot of people don't talk about arthritis because they think it's just kind of normal and it's, it's not going to kill them. So why complain about it? It's so important to talk to your healthcare provider about that. And we have some tools available to help with that conversation. So I did want to just mention that managing weight, as Nick already mentioned, is an important part of managing arthritis, and also protecting joints and even preventing some forms of arthritis like osteoarthritis are important as well. But for the purposes of this webinar today, we're really just going to focus on that learn, be, talk, because those are some of the key resources that we have available to you. So I'm going to go ahead and kick it back to Nick now, who's going to talk about some of the Arthritis Foundation's resources.
Excellent. Thank you so much, Serena. Today, I'm going to highlight just a few of the Arthritis Foundation's resources to help you as an organization or you as a person living with arthritis deal with arthritis pain. So we'll talk about our helpline, patient education resources, especially our Connect groups, and our physical activity program, Walk with Ease. So if you remember nothing else, please know that the helpline is here to help answer all of your additional questions about arthritis. The Arthritis Foundation's helpline is staffed by licensed clinical social worker and other trained staff and those living with arthritis to help you navigate the access to the best health and healthcare that you deserve. So we have many people living with arthritis that are confused about how they can access healthcare, finding a rheumatologist. They may have questions about their insurance. They may have questions about open enrollment during that period during Medicare. They may be having trouble paying for arthritis care, whether it's doctor office visits and copays or paying for prescription medications. We don't provide cash assistance, but there are lots of programs that do or provide coupons or resources, and we have the knowledge to help you and save you a lot of Googling and a lot of phone calls to help you find the best resources for your particular situation. We also can help answer questions about kids living with arthritis. I didn't mention this at the top of the program, but of those 100 forms of arthritis, those include juvenile rheumatoid arthritis and other forms of arthritis that affect kids. And those kids often will have difficulty in school, miss a lot of days of school. They may have to drive very far to get specialized care. So we can provide resources for them. We can help with in-home care services, kind of deciphering Social Security and other disability issues and veterans benefits. You can call us at 1-800-283-7800. You can email us at helpline@arthritis.org, or just check out our website. And actually, if you go to arthritis.org, at the bottom of every page, there's a little tab that says, I need help. And if you click on that, you'll get right to our helpline portal. Next slide. One of the most important things you can do if you live with arthritis is to be an empowered patient, a person that understands your arthritis and the ways to manage it. And the Arthritis Foundation has many resources to help you do that. That includes webinars. We just had one last night that featured our friends at OA Action Alliance. and talking about exercise. But even this year, we've had a webinar on anti-inflammatory diets. We have motivating yourself and setting goals. We have arthritis in the body coming up next month. So we typically have a world-class panelist talking about arthritis and its management. And all of those webinars are also archived on the Arthritis Foundation website and on our YouTube channel. If you are a fan of podcasts and health information, our podcast is a conversational review of arthritis and resources. Our host has arthritis, and she talks to other experts about living with arthritis and resources that can be available. And we're bringing back in-person events in the community, and we do have in-person events planned for the North Carolina area. We'll be posting them at arthritis.org/events. But we have typically rheumatologists, those arthritis specialists, talking about arthritis, its management, and resources. Next up, our connect groups. We have two different options for connect groups. And when I say connect groups, you'll typically think of a support group, right? We talked earlier about how many people with arthritis feel alone and isolated. So one of the most important things that our connect groups do is bring people together around a shared understanding that arthritis is real, that it affects people's lives, and that people want to get together and they can do better when they are united. And so our connect groups do meet in person. We have groups that meet at local community spots or restaurants. Sometimes they have speakers, sometimes they just have conversation. And now we also have connect groups that meet online. And our online connect groups meet by location. So you may have some folks that meet because they're all from Greensboro or Winston-Salem. But other groups form because they meet around identity or a shared topic. So we have connect groups for Hispanics with arthritis, African Americans with arthritis, veterans with arthritis. They may meet because they have a shared diagnosis like osteoarthritis or rheumatoid arthritis or gout. We have about 20 groups that meet because of identity or a shared topic. And those groups meet at least once a quarter. And again, it's just a great opportunity to either get in person or meet online to openly share about how you're managing your arthritis, ask questions to other folks, and hear from experts. Next up. And now we have our Walk with Ease program. And Walk with Ease is a physical activity and self-management program. It's a 6-week program where you walk at least 3 times per week for 6 weeks. And you will increase the amount of walking that you do each week throughout the course of that 6-week period. But along the way, you'll learn about goal setting. You'll learn about how to walk safely and have fun with your walking. You'll do some fit tests to see how you're improving in your stamina and balance. And Walk with Ease is one of the best classes or courses if you are someone that hasn't been physically active for maybe a long amount of time. Maybe you have a lot of joint pain and you're really worried about exercising safely. This is a program that is very gentle in how it increases the amount of walking that you do and provides a lot of information and support along the way. This program can be done in the community with a trained instructor, with other people with arthritis, and it also can be done on your own. You can use the Arthritis Foundation's Walk with Ease book and follow along, or you can do it virtually or self-directed enhanced, where you can participate in a cohort of people that are walking alongside you, and you may meet up with them on a Zoom call, or you may have an email listserv or a Facebook page. There are lots of ways to do Walk with Ease and lots of ways to get moving safely in the community. And now bring back Serena.
All right, thank you, Nick. Just before I get into the resources that the OA Action Alliance has available to help you, Um, I wanted to introduce the Alliance. We're an organization of about 150 different organizations committed to elevating OA as a national health priority. So as Nick mentioned, OA is the most common form of arthritis. So our focus really is around how to address it through policy and resources, education, et cetera. So we really try and work through policymakers, through communities, community-based organizations like many of you on the call today, through individuals themselves, healthcare providers. So we're really just trying to have a broad reach to try to educate and elevate osteoarthritis. We have a number of tools and resources that are available to educate your audiences. So if, for example, you work in a senior center and you're looking for handouts on what is osteoarthritis, we've got you covered for sure. If you are in a community-based organization and you're looking to perhaps offer a program to your constituents, like the Walk with Ease program, we have a number of tools and resources to help you kind of identify which of the arthritis appropriate evidence-based interventions, which I'll talk a little bit about next, are maybe most appropriate for your organization and the people that you work with. So we've got those resources available. We also have e-newsletters that go out, monthly lunch and learns that are just 30 minutes long. So I would definitely encourage you to check out our website, which I can put in the chat when I'm done talking. It's oaaction.unc.edu. oaaction@unc.edu. Oh no, that's our email address. Yeah, there it is. Thank you. So this slide right here is actually a summary of the arthritis appropriate evidence-based interventions. So you can call them ABIs if you want for short, or AAEBIs, but essentially what these are programs that have been evaluated in a randomized controlled trial and proven to have positive impacts on people with arthritis. They're generally categorized into either a physical activity program or a self-management program. I'm sure a lot of you on the call today are very familiar with evidence-based programs, so you kind of know that they are packaged interventions that kind of you can take off the shelf and you can bring to your population. So that's what these are, but they're specific to the arthritis population. We at the Osteoarthritis Action Alliance actually oversee the review process for the AAEBIs, and our current annual review is actually ending tomorrow. So we've already have a number of applications in, and I'm hoping that the lists that you see here will be expanding soon to include other programs that maybe are not on here already. I did want to highlight on this slide that there are several of these AAEBIs that are readily available here in North Carolina. So if there's one that particularly jumps out to you as something that you maybe want to participate in or maybe bring to your location, Nadia is going to talk a little bit more about that later on, and I would highly encourage you to do that. Also, definitely check out this website. There's a little video on there, and there's more information about how a program can become an AAEBI. Next slide. So, one of the AAEBIs that Nick mentioned, of course, is the Arthritis Foundation's Walk with Ease program. And we at the OA Action Alliance have been highly involved in disseminating the program for the past 7 or 8 years. We had kind of started with focusing on the group-based program, but have since really narrowed our focus on improving the dissemination and accessibility of the self-directed program. So in order to kind of support the dissemination and really the automation of a lot of the administrative processes that go along with a self-directed program, like getting the Arthritis Foundation books out to everyone and sending weekly emails and collecting data, we've really felt like we needed to create a system that could help us do that and automate it for us. And so we created what we call the Walk with Ease portal, which has now expanded into the Camina con Gusto portal, so the Spanish version of Walk with Ease. And the system really allows service providers to easily register participants for the Walk with Ease or the CCG program, to get the books to them, send them the automated emails, track their walking, gather their registration and evaluation data, create reports, all those things. But it also allows the participants to be able to log in. They create a secure online account and they can track their goals. They can, set goals, track their walking, access different tools and resources, view videos, listen to audio lecturettes, just a number of tools and resources that we feel support them in completing the program. So the portal is available here in North Carolina, and Nadia is going to talk to you about it a little bit later. And I just did want to show you the current reach of it. So we're just about in every state. I'm not going to name any names, Mississippi, but we need to work on Mississippi, apparently. Next slide. So as I mentioned, although we focus a lot on Walk with Ease, we do have resources that can help you decide if Walk with Ease is the right program for you, or if maybe one of the other ABBYs is more appropriate. So we have this library of resources. If you go to our website and then you click on, click on resources and then click on community organizations, and there you'll see each of those purple kind of squares is like a tab, and you can click on the tab and get to different resources, kind of to help you go from, making the case as to why arthritis is something important to address, kind of what Nick was talking about at the beginning of the presentation, to, here are the programs available, here's the program we want to do, and now here are some tools and resources that we can adapt and use in our community. So that's all available for you. We really don't want you to have to recreate the wheel. Next slide. We also have other educational tools and resources to help you educate yourself, or to maybe help you educate your leadership or your constituents or whomever you're working with. So on the left-hand side of this slide is an example of a handout addressing getting started with physical activity and arthritis. So this would make a great handout in a senior center or nutrition site or a clinical setting. So it's available in PDF. You can just print it off and use it. The right-hand side is an example of our learning modules. So these really cover every aspect of OA and OA management. So if you're looking to know more about OA, this is a great place to start. If you just go to oacaretools.org, it'll take you right there. I just wanted to make a plug. If you're looking to create kind of a bridge or community clinical linkage, if you are, a community provider who's looking to partner with healthcare, or you're a healthcare provider looking to partner with community-based organization, I think arthritis is kind of a perfect rallying point. And I would really, suggest you take a look at some of these tools as kind of conversation starters either way, because I think that can really, really help you. And then finally, I just wanted to share with you, next slide, Nadia. Yep, thank you. We're working on getting more resources available for Spanish speakers. Right now, we have a website. It's kind of like a website within our OA Action Alliance website. And it provides information directly for those with OA or who perhaps have a loved one or a neighbor or someone who has OA. So there's not as many, like there aren't any handouts yet for like an organization to give to a Spanish speaker with OA. But if you can direct them to this website, it links to the Camina con Gusto portal. It links to other vetted outside trusted resources to help people who are Spanish speaking and may need more information. And we're trying to seek more funding so that we can translate those OA care tools items that I mentioned previously into Spanish, because we think that will be really essential for closing the gap and reaching those populations. I am going to go ahead and turn it back to Nadia now.
Great. Thank you so much, Serena. And thank you, Nick, for all of the awesome information. I'm excited to share with y'all some resources specific to North Carolina. We at Healthy Aging NC serve as a statewide resource center for evidence-based programs, including the ABBYs that Serena mentioned. And we rely heavily on national organizations such as the Osteoarthritis Action Alliance and the Arthritis Foundation to support us in making these statewide resources available. So the first resource I want to share with y'all, and I am entering the World Wide Web here, is just our website. So you'll see here a list of all of the evidence-based programs that we support at Healthy Aging NC. And you'll notice that many of them are on that list of the ABBYs that Serena reviewed, including Tai Chi for arthritis and fall prevention, Living Healthy with Chronic Disease and Chronic Pain Management. And that Living Healthy branding is just North Carolina's version of the chronic disease self-management and chronic pain self-management programs. I also wanted to point out the social bridging and health coaching projects. They might also be relevant for folks with arthritis in North Carolina, because these are one-on-one services that can help people get connected to resources. So this could be especially useful for folks who can't or won't participate in person or group programs for any reason. And then of course we have Walk with Ease that Nick mentioned, and the Spanish variations of both the Living Healthy with Chronic Disease and Diabetes program. I also want to point out the A Matter of Balance program, which is actually a fall prevention program. And as Serena mentioned, that connection between falls and arthritis. And so this program can really help people who are at a higher risk of falling, who have a fear of falling, to reduce that fear, become more steady on their feet. And so while this isn't an arthritis specific program, it could be helpful for folks to be able to graduate, if you will, into the Walk with Ease program, for example, and become able to meet the minimum requirement of that program to be on their feet for 10 minutes without increased pain. So we select programs that we support based on this idea of a continuum of care to ensure that programs are available for people of all different levels of ability and need. Similarly, I mentioned the diabetes self-management program. So that's also not arthritis specific, but we do know that 52% of adults with diabetes also report having arthritis in North Carolina. So these programs fit together nicely to support people in our state in preventing falls, managing various chronic conditions, including arthritis. I also wanted to point out the Powerful Tools for Caregivers program. This is just a program which is designed to help family caregivers take care of themselves while caring for someone else. And I think that's all the programs here. One other resource I wanted to share with y'all on our website: if folks are interested in becoming a leader of the Walk with Ease program, you can reach out to me and I can help you with that. And then we also have a referral page. If you want to refer to any of these programs, you can fill out this form on our website and make that referral. Okay, so I think we covered everything in that resource, which brings us to this next one, provided by the Arthritis Foundation. It's called Arthritis at Work, and you can see our Healthy Aging NC logo here. And this is a free resource available to any organization that wants to partner with the Arthritis Foundation in the same way that we have to make this website available to your employees, and you could have your logo here. And what I've really appreciated about having this at Healthy Aging NC is being able to share it with our team, both internally at Healthy Aging NC, as well as with our network of partners who we work closely with, who may be suffering from arthritis themselves and are meanwhile working on the statewide CDC arthritis grant that I manage. So they too can benefit from these resources that the Arthritis Foundation tailored specifically for employees in the workforce. So you'll notice there are also tools for managers here that can help them help their employees with arthritis succeed at their place of work. So thank you, Nick, for helping make this resource available to us in North Carolina. And thank you, Serena, for helping make these next two resources available to us. So Serena already mentioned this Walk with Ease registration portal, and I wanted to show y'all our Healthy Aging NC portal specifically so you could see how it works. So anyone who is a North Carolina adult resident can sign up for this program at any time at no cost to them. You can select either to have a printed copy of the guidebook that Nick mentioned mailed to the mailing address of your choice, or you can access the ebook in the portal. So I'm going to actually log in as a participant so y'all can see what this looks like. On the other side, I know Serena already kind of described these resources available to participants, so I wanted to give y'all an example. So you can see I'm in week 4 of the program. I can watch this video with Nick in it, which is great. I can read chapters from my book. I can review key health information. I can enter in my days walked and minutes walked this week, and I can set goals for next week. And since I signed up for the ebook, I can also access that here. So I just wanted to show that to y'all and remind you that it is available at no cost to anyone that you think could benefit from the program in North Carolina. And then also we have, I'm going to actually log out as a participant so y'all can see what the Spanish speaking portal looks like. So we also have the portal for Camine con Gusto available to Spanish speaking North Carolina adults. So they can register for the program at any time here, also at no cost to them, and it's all the same content. I just wanted to show this page so you can see the registration page looks a little bit different, but it's all the same quality content translated into Spanish. And lastly, I just wanted to briefly review how to engage with all of these awesome resources that we've shared with you today. So like I mentioned, I showed you that referral page. You can refer yourself or your patients, clients, loved ones to any of our programs. You can use that referral form on our website, or you can find us listed in NC 211 and NC Care 360 referral platforms. I'd also invite you to review the resources provided by the Arthritis Foundation, by the Osteoarthritis Action Alliance, and on our Arthritis at Work website. And of course, please share those registration portals with anyone who you think could benefit from the program or sign up for the program yourself. And also stay in touch. So if y'all want to learn more about anything any of us talked about today, please reach out. This is our contact information. And thank you for listening. Let's open it up to questions. So we're going to launch a poll asking what you'd like to learn more about just to help kick off this Q&A. So please answer the question on your screen when you see it. And with that, I'll hand it back to Centralina to share your questions with us. Thank you.
Thank you, Nadia. I hope I pulled up the right question. I think I'm on question 2 about what people are offering currently. If you want that information, I'll let people keep answering.
Oh, okay, great. Yeah, we can get that information and then we can jump to the last
third
question. Yes, thank you.
So thank you guys for sharing. And as everybody's answering this, like I said, Q&A time. So if you want to start putting any questions in the chat or in the Q&A, we'll start facilitating those here in a second. All right, let's see. I'm seeing a request to put the contact info back up, Nadia. All right, and then I see a question specifically. It's about the Fit and Strong program. It said COVID paused the program, but we are ready to begin again. Do you have the website where I can retrain?
Can you repeat that, Caitlin? The website where folks can what?
Retrain to be, I'm guessing, a leader.
Oh, okay, great. Yeah. So if you're interested in becoming a Walk with Ease leader, please reach out to me directly, and I can set you up with everything you need. So it just kind of depends on if you've been trained before. If you've offered a program within 12 months of being trained, you don't need to get recertified. But if you haven't, check in with me and I can help guide you to next steps. I'd also invite Nick to add anything as the from the Arthritis Foundation.
Thank you. I think she was looking for Fit and Strong.
Fit and Strong.
Oh yeah,
Fit and
sorry, it
Strong.
says Fit and Strong.
Another great program. Yep.
Oh, okay. I actually don't have information about that program. So if you noticed on Serena's screen with all of the arthritis appropriate evidence-based interventions, not all of them are supported by Healthy Aging and C. So we don't have grant funds to support all of them. However, I'm always happy to provide technical assistance for folks in North Carolina who want to offer any of the Abby's listed. So if you are interested in that program and you want to learn more, I'm happy to learn alongside you. We just don't have any existing information and resources available on our website for that particular program yet.
Let's see, I have a specific to the Charlotte area question here. Do you know where Tai Chi is being offered in the Charlotte area? And that, I think you guys might have some resources as to where people can look that up.
Yes, so I would recommend connecting with your region's area agency on aging. So if you look up North Carolina's 16 area agencies on aging, forgive me for not knowing the exact region that Charlotte is in at this particular moment off the top of my head. But if you want to follow up with me. Oh, that's right. Oh my gosh, of course. It's Centralina, connect with Centralina, and they can let you know about the programs in your area. Also on our Healthy Aging and C map, we do have a map of programs, including Tai Chi for arthritis and fall prevention, and you can find Tai Chi available in your area.
All right, everybody, any more questions before we close out? Their thank yous and claps and all of that. All right. Well, thank you guys so much for being here today. Thank you to our speakers. You guys were wonderful. And you guys all have their contact information if you have any specific questions. And then, so we do have some upcoming webinars. We never want to forget that. So I'm actually going to put a link in the chat where you can sign up for any of our upcoming webinars. So we hope you will join us again. And until next time, thank you guys.
Thank you.